Well, it's estimated more than 3 million Americans have undergone some form of laser vision correction. Most patients who have had laser eye surgery are happy with their visual outcomes, but roughly about 3% experience visual problems. A new technology known as WavePrint or Wavefront may soon offer help to those still struggling after laser surgery and possibly allow new laser surgery candidates to obtain supervision. Here to discuss this potentially exciting new breakthrough is our friend Dr. Brent Reed of Griffin and Reed Eyecare. Doctor, nice to have you here again.
Thanks, Walt.
How is the WavePrint laser different than traditional lasers?
Well, traditionally we've always been able to measure the way light bends into people's eyes in basically two parameters or two ways. One is either if you're near or farsighted, that's one way, and if you have astigmatism, that's a second way. But in the last few years, we've discovered that there are other ways that light bends into the eye. In fact, 5 or 6 levels beyond that in most people are not very significant, but in some are very significant to the way that they see, particularly under different lighting conditions. And those different ways in which light bends into the eye are called aberrations. And these particular aberrations are called higher order aberrations. And they do have some significance in just about everybody, but in some they're extremely significant.
Now, doctor, some of the people, as you know, who have undergone laser surgery, they say they have starburst or glare afterwards. What does WavePrint do for those patients?
Well, starburst and glare can exist for a number of reasons after laser vision correction. And some of it has to do with pupil size to begin with and the type of laser that was used to correct the vision. But what WavePrint can do is it can actually eliminate any of those higher order aberrations, or hopefully treat those higher order aberrations that may be causing those symptoms of starburst and glare at night.
Now, as far as WavePrint, people who are thinking about maybe doing the laser correction, should they wait for WavePrint?
Well, what's really fascinating about it is the WavePrint's in the process of being approved right now by multiple companies with multiple lasers. We actually have a system in our office at this point that allows us to take calculations derived from the WavePrint readings and then put that into a laser, grind a lens called a preview lens we can then take and put in front of the patient and see if that makes them see better than the traditional 2 parameters that we measure now, which is fascinating and exciting, because if it does, we tell them they should wait for the WavePrint. If not, we tell them it's fine to go ahead now.
FDA approval is anticipated of WavePrint, or would it be like the old days with Vizx when people would go to Canada first and then later it was available in the United States?
There are people going to Canada now to do it. There are several places in Canada doing it, though their experience there is not much greater than a few places in the United States. What I think will happen, Walt, one company has already received permission to do a limited amount of WavePrint analysis and treatment, but it looks like early spring, early summer next year, late spring, early summer next year, we'll probably have permission to do just about all parameters for all patients here in the United States.
Dr. Brent Reed, we thank you as always from Griffin and Reed Eyecare for joining us today.